Welcome everyone to the Agricultural Worker Identification, Registration, and Reporting in the UDS webinar. There are three main learning objectives for our session today. By the end of the session, you'll be able to differentiate between registration and classification and eligibility. You'll be able to identify the industries and tasks that meet the definition of agriculture and should be considered when classifying an agricultural worker for UDS reporting. And you'll be able to distinguish the different classification types for ag workers and utilize this knowledge to correctly classify and report your ag worker patients. For those of you who may not be familiar with NCFH, we are a private nonprofit organization located in Austin, outside of Buda, Texas. We're located in Buda, outside of Austin. Our mission is to improve the health of farm worker families, and we do that by providing programs, trainings, and technical assistance and resources. One of the ways that we work towards this mission is through the Ag Worker Access Campaign. This campaign was launched in 2015 as a joint effort between the National Center for Farm Worker Health, NCFH, and the National Association of Community Health Centers, NAC. We, along with health center staff and other ag worker advocates, knew that more could be done to increase access to quality healthcare for America's agricultural workers and their families. And the result was the Ag Worker Access Campaign. Over time, we've seen steady increases in the number of ag workers served in health centers since the campaign's launch in 2015. And in 2021, we surpassed our halfway milestone of reaching 1 million ag workers in the health center setting. Unfortunately, in the 2022 UDS data, we saw a decline in these numbers, but we're confident in the hard work and determination of health centers across the country that we will continue to grow from here. But we need your help, so we encourage you to learn more about the campaign and sign up to join the campaign, and you'll find information coming through the chat. So there are several reasons why it's important to identify a patient as a member of a special population. In this slide, we're going to talk about ag worker identification and the registration of special populations and why this is important. So the federal government has identified groups of community members that have limited access to healthcare services and have unique challenges in accessing those services. Therefore, the federal government provides funding to support the provision of health services that specifically target these special populations. Patients considered belonging to a special population include those listed on the screen: homeless or people who are unhoused, migratory and seasonal agricultural workers, veterans, patients served by school-based health centers, and patients served at a health center located in or immediately accessible to a public housing site. It is important to identify all special populations, not just your agricultural workers. All health centers report these populations regardless of whether or not they directly receive special population funding. So the UDS stands for Uniform Data System. This is a government-required electronic reporting mechanism for health centers funded under the Public Health Service Act, Section 330. This includes community health centers, programs for migrant health or migrant health centers, healthcare for the homeless, and residents of public housing. Here on the slide, you can see a list of some of the information that is reported in your UDS report, including number of patients served, patient population demographics such as race, ethnicity, age, income levels, insurance sources, services provided, and clinical processes and results, types of staff employed by the health center, and types of funding and payments received by a health center. Why is it important to accurately report your UDS information? First, it's important to be in compliance with the requirements of the federal government, and it's important to show accountability and good return on investment so that we can be good stewards of our funds and have funding continuation. So what's the relationship between status verification and funding? When health centers apply for funding, they will mention in their grant applications the number of migratory and seasonal agricultural workers they are planning to serve. If they receive the grant funding, they also acquire several obligations. Among those obligations are to be in compliance with the program requirements, to provide services to the target populations, and to submit their UDS reports. If the health center is able to be in compliance with these program requirements, establish an identification and verification process, and show that the funds were used to provide services to the people it was intended for, and submit their reports on time, the likelihood that the health center will continue to receive funding is pretty good. So who reports what and where? To answer these questions, it's important to refer to the 2023 UDS manual. The manual shares that health centers that receive Section 330G funding must provide separate totals for migratory and seasonal agricultural workers on lines 14 and 15 of their UDS reports, and line 16 will be the total. For other health centers that do not receive 330G funding, they report their total migratory and seasonal agricultural worker patients on line 16. All health centers report these populations regardless of whether or not they directly receive special population funding. So this slide talks about the difference between verification and eligibility as it's related to agricultural worker special population designation. It's important to remember that we are verifying special population status when we identify a patient or family member as an agricultural worker to properly report and document in the UDS report. This does not have anything to do with the person's eligibility to receive healthcare services at your health center. All community members can receive services at health centers. However, the patient may be eligible for a sliding fee discount based on income or other programs depending on your health center's specific program requirements. The classification of a patient does not impact their eligibility to receive services. To verify agricultural worker status, specifically migratory or seasonal agricultural worker status, you need to know three things: the definition of agriculture, the types of industries and tasks in agriculture that are included and excluded under HRSA's rules, and the classifications of agricultural workers. So we're going to break these three things down and go into some more detail. Starting with the definition of agriculture. This slide includes the exact language for the definition of agriculture as defined in the legislation. Basically, it involves everything from prepping the soil, seeding, planting, growing, picking, packing, to transporting. Agriculture means farming in all of its branches, including crop production, animal production, aquaculture, and the support activities involved in these industries. This definition is specific to HRSA, and the definitions could vary among other entities and programs such as migrant education or other ag worker serving programs. In addition to the definition of agriculture, HRSA has defined the three classifications of agricultural workers for UDS reporting. The three classifications are migratory, seasonal, and the aged and disabled, or former migratory agricultural workers. Our migratory agricultural workers, their principal employment is in agriculture, and they are employed within the last 24 months or 2 years. They establish a temporary home for the purpose of working in agriculture. Our seasonal agricultural workers, their principal employment is in agriculture on a seasonal basis. They're also employed within the last 24 months or 2 years. They are not migratory agricultural workers because they do not have to establish a temporary home in order to work in agriculture. And our third category are the aged and disabled. These are former migratory agricultural workers that are unable to work in agriculture due to age or disability. So next, we're going to look at the tasks and industries included in HRSA's definition of agriculture.
Thanks, Katie. So now let's break down the tasks and industries that are included in HRSA's definition. So the North American Industry Classification System, or NAICS, was used to develop the definition of agriculture and included tasks and industries. And so the codes that we're going to be interested in for our purposes today are 111, which is crop production, 112, which is animal production and aquaculture, 1151, which is support activities for crop production, and 1152, which includes support activities for animal production. So there'll be a link in the chat for you for the NAICS code search. So if you're ever in doubt, you can search by keyword there. But we'll provide a little more information on these specific categories in the next slides here. And we'll go on to the next slide, please. So starting with 111, which is crop production, just taking a closer look at this category. This includes grains and nuts, fruits and vegetables, nurseries, and other commodities like tobacco, cotton, hops, and even Christmas trees. And then the support activities, as you see here on the slide, include harvesting by machine and post-harvesting activities like sorting, packing, and processing if it's done on the farm. And it also includes farm labor contractors and crew leaders, soil preparation and cultivation, and transportation that's affiliated with the farm. So 2 important notes about this support activities here are that packing and processing must be done on the farm versus off farm to meet the definition of agriculture. And transportation must be affiliated with the farm also to be included. So if transportation is contracted out to a different company, a trucking company, then that patient's job would fall under the trucking industry. It's a transportation industry versus the agricultural industry. And then looking at 112, animal production and aquaculture. This includes dairy farms, animal farms, poultry farms and hatcheries, and fisheries. And a note to on this one as well is that fisheries are included in the definition of agriculture. Deep sea fishing is not. So if you think about it, again, in the fisheries, they're cultivating the fish for whatever the ultimate destination is. And for deep sea fishing, you're just going out and catching whatever's already been cultivated. It's already out there naturally. So that's the differentiation there. So we would include fisheries, but not deep sea fishing. And then other animal production that you may have in your area and may not have considered as part of agriculture includes horse farms, donkey farms, llamas, bees, crickets, and worms, fur-bearing animals, lab animals, and even companion animals are included in the definition. So companion dogs, cats, birds, all of those would be included in the industries for agriculture. And then the support activities include the things listed on this slide. So boarding, branding, reproductive services, and livestock spraying and cleaning. And then we also have here some examples of tasks performed by ag workers, because in addition to being familiar with the industries that ag workers work in, it's also important to be aware of the tasks that they do, because they may come into your health center and self-identify by the work they do or the tasks that they do. So they may say, I'm a detasseler. So if you're familiar with all the tasks and industries in your area, then that'll be a cue for you to ask some more questions, because they may be an ag worker. And we do recommend having a list of your local tasks and industries as a resource at your front desk. This is a great activity you can do as a team, and just have that available as a resource, as a quick kind of cheat sheet for your staff. And then now we're going to look at excluded tasks and industries. So we know which ones are included in the definition, but some that kind of get tricky and may come up as a question that are excluded include meat and meat product merchant wholesalers. So raising the animals is included, but once it gets to the processing plant, then it's not included in the definition of agriculture anymore. Landscaping services comes up as a common question as well. Nurseries are included because, again, they are cultivating the seeds, the plants, all the way till whatever the final destination is going to be for them. Landscaping services, you're managing, most of the time they're managing the yard, and so they are purchasing the plants from a nursery, but they are not cultivating them. They may be maintaining them just to keep them alive, so they may be watering them once they purchase them, but that's not part of that industry. So they would, landscaping would not be included. Spectator sporting is not included as well. So if you have horse racing in your area, those horse farms that we mentioned are included. But if someone is solely working on the racetrack with the animals there, they would not be included. That would be spectator sport industry. Also, trucking, timber, and specialized freight are not included. So now we know what those NAICS codes are. We're ready to start looking at the verification process. So we'll go on to the next slide. And these are the steps in our verification process that we're going to go into in detail with you. So step one, we want to establish the occupation. We want to know if they are working in agriculture. So that's what all the previous information we shared with you will help you determine. The next step is to determine the time frame. That's 24 months. At any time in the last 24 months, if they've worked in agriculture, we want to go on to the next step. We also want to look at their migratory status, their seasonal status, identify if they're a former migratory worker, and then identify family members. So I'm going to transition it back to Katie, and she's going to go through each one of these steps in detail with you.
Thanks, Lisa. So in our first step, for these 6 steps in the verification process, we will be sharing a verification question that goes along with that step in the verification process. So in the blue box on each step slide, you'll see the verification question that we recommend for accurate identification and classification of your agricultural worker patients. These blue box verification questions are questions we recommend including in your policies and procedures and in your patient registration forms to reflect these definitions and ensure that your staff are consistently and accurately identifying and reporting your ag worker patients. So for our first step, establishing occupation, the verification question for this step is, have you or anyone in your family worked in agriculture? After we have established the occupation, we want to determine time frame. So the verification question is, have you worked in agriculture? Have you or anyone in your family worked in agriculture anytime in the last 24 months or 2 years? There's no specific amount of time that an agricultural worker has to have worked in agriculture in those last 24 months or 2 years. It could be 1 week out of the 24 months. It could be the whole time. The key is any time in the last 24 months or 2 years. Due to the nature of agricultural work and seasons, some agricultural workers will engage in other industries outside of agriculture for additional income throughout the year. So it's important to ask if it's been any time in the last 24 months or 2 years. Then we need to determine whether the patient is a migratory or seasonal agricultural worker. So step 3, the verification question would be, have you or anyone in your family established a temporary home in order to work in agriculture? It's important to remember that the distance that a person travels to do agricultural work is not important. What is important is if the person has to establish a temporary home in order to do their work in agriculture. Housing determines the status, not the distance. For example, in large states like Florida or Texas, you don't necessarily have to cross state borders to not be able to return home at the end of your workday because they have traveled a long enough distance that they're not able to return home at the end of the day. When a person or a family leaves the area in which they live to do agricultural work and must live somewhere other than their home in order to do such work, that person is considered to have established a temporary home. So if a person does not have to establish a temporary home in order to work in agriculture, we want to consider them for seasonal agricultural worker status. The verification question here is, have you or anyone in your family worked in agriculture on a seasonal basis without having to establish a temporary home? So what does seasonality mean? Seasonal basis is not defined in legislation. Unlike many other occupations or jobs, the stability of work in agriculture varies dramatically and is dependent on many factors like weather, demand for commodities, workforce, natural disasters, things like that. The instability is what defines seasonality. A worker may experience changes in the type of job, hours worked, wages earned, tasks performed, and their income may change with the season. In other words, agricultural workers, seasonal agricultural workers, can work year-round and be perceived as full-time agricultural workers, but are still considered seasonal if there is a change in their job responsibilities, tasks performed, hours worked, or income earned. So the key with seasonal status is that there's a fluctuation or change that determines this seasonality. And then step 5 is to make sure we identify any former migratory agricultural workers. The verification question to ask is, have you or anyone in your family stopped migrating to work in agriculture because of age or disability? In the Consolidation Act of 1996, the definition was expanded to include aged and disabled migratory agricultural workers. Aged and disabled, the definition is clear that these are former migratory agricultural workers, and it's important to note that these workers stopped migrating due to their age or disability. Some of your patients prior to retirement or disability may have been both migratory and seasonal at some point in their career as agricultural workers. So it's important to ask this question as if they ever migrated to work. If they did, then you can classify them as aged and disabled. This classification doesn't apply to seasonal workers, only former migratory agricultural workers. And you'll report these patients as migratory agricultural workers in your UDS report. The final step, step 6, is to identify all family members. In the Consolidation Act of 1996, the definition was also expanded to include family members of agricultural workers. All family members of verified agricultural workers are also classified as agricultural workers. This is regardless of a family member's insurance status. Dependents should be classified as migratory or seasonal, the same as the primary agricultural worker family member. This directly applies to children. Cross-check and make sure you are accurately capturing all family members in your UDS reporting. It's also important to note that it's up to the health center to decide what the definition of family member is. This is not clearly defined in our guidance, and it's important to define who your health center will include as family members in your policies and procedures, so everyone is on the same page and using the same definitions. We know that ag workers have unique living situations where multiple families may live under the same roof, or multi-generational families may be living together. Again, it's important to have a policy and procedure in place that reflects this criteria and the definition of family members so that all staff are aware and can provide accurate and consistent reporting. So those are our 6 steps for the verification process. The next part of this presentation is going to be a case study activity. So we're going to ask that participants open up your chat feature in your toolbar, and we're going to go through some case study scenarios where we'll have a patient description, and we'll go through each step of the verification process and ask the 6 questions to see if we can determine this patient's agricultural worker status. So you'll use the chat to answer yes or no to each verification question, and then we will see what we come up with at the end of each scenario. So I will start with case study 1, and I'll read the patient scenario. This is our patient, Mr. Escobedo. He is 52 years old and received a contract for work in the US and arrived in South Carolina from Mexico 3 months ago. He lives in employer-provided housing with other workers where they harvest melons. He's at your health center today because he is out of his blood pressure medication. So based on the information that we have, for the first verification question, is agriculture the principal employment? Has this patient or anyone in this patient's family worked in agriculture? So please use the chat to respond yes or no. Okay. I'm seeing all yeses. So we will continue on to the next step. So step 2, our verification question is, has this patient or anyone in this patient's family worked in agriculture any time in the last 2 years? So based on the information we have, would you respond yes or no? Okay, I'm seeing yeses. Okay. So yes, based on the information we have, he's actively working in agriculture. So now we need to determine whether the patient is a migratory agricultural worker or a seasonal worker. So our verification question for migratory status is, has this patient or anyone in this patient's family established a temporary home in order to work in agriculture? Would we say yes or no for this question, for this patient? Okay, lots of yeses. Okay, any opposing? Okay, so just to be sure, because it's important to go through all the steps, all the questions. For seasonal status, has this patient or anyone in this patient's family worked in agriculture on a seasonal basis without having to establish a temporary home? Yes or no? Okay, I'm seeing some no's, and we know that keyword here, the keywords in this patient scenario is that they're currently living in employer provided housing. So that's a pretty good assumption that they have had to establish a temporary home. So we'll continue on to step 5. The verification question here is, has this patient or anyone in this patient's family stopped migrating to work in agriculture because of age or disability? So yes or no, based on the information we have in this short description. Okay, seeing no's. And then our last step here is to identify all family members, which we don't have any family members mentioned in this description. So we've covered all our bases. We've gone through all 6 steps. How would you report this patient in your UDS reporting? Would you report them as a migratory agricultural worker, a seasonal agricultural worker, or can you not classify them as an agricultural worker? Please share with us in the chat. Okay. Great. So I'm getting a lot of migratory worker in the chat. Let's see if there's any opposing. Okay, it looks like we're all on the same page. So we should classify this patient as a migratory agricultural worker in our UDS reporting. Okay, so we have a second case study to cover. I do want to pause real quick. If there are any questions about this particular case study, please let me know. But I think as a group, based on the chat, we were all very much on the same page. Great job, everyone. Okay, let's see if this next case study kicks it up a notch and is slightly more challenging. We'll see. So our patient is Maya. She's 8 years old. She's at your health center for her back to school health screening and vaccinations. Maya's mother brought her in today, and she works at several local farms depending on the crop season. Right now, Maya's mom is working at a farm where she cleans harvested tomatoes to be transported to the packing facility. So let's start with step one. Is agriculture the principal employment? And has this patient or anyone in this patient's family worked in agriculture? Yes or no? Okay, it looks like unanimous yeses. So let's move on to determining the time frame. So has this patient or anyone in this patient's family worked in agriculture any time in the last 2 years? Yes or no? Okay, I'm seeing lots of yeses. Okay, so now we want to determine, we've answered yes to step one and two, so we should determine whether this patient is a migratory worker or a seasonal worker. So step three, has this patient or anyone in this patient's family established a temporary home in order to work in agriculture? Yes or no? Okay. It looks like we're all saying no based on the information that we have here. We're saying no. So we'll determine in step four whether this patient meets the seasonal status definition. So has this patient or anyone in this patient's family worked in agriculture on a seasonal basis without having to establish a temporary home? Did the patient's job, hours, tasks, or income change with the seasons? Yes or no? Okay, I'm seeing a lot of yeses coming through the chat. Okay. All right, so two more steps. We want to ask every patient all of these questions to ensure. So step five, based on the information we have, has this patient or anyone in this patient's family stopped migrating to work in agriculture because of age or disability? Okay. Lots of no's in the chat. No. So you're right. We don't have any information on this specific question in our patient scenario here, but it is possible that in a real patient scenario where you're able to ask more questions or more information could be shared, that the Maya's mother or another family member potentially could also be an agricultural worker who used to migrate but no longer can migrate because of their age or an injury or disability. So it is important to ask all of these questions to every patient just to make sure, because that would change how we would classify this patient if more information were to be shared on this particular question. So step six, identify all family members. So now that we've gone through all 6 steps, how would we classify Maya, our patient, for UDS reporting? Migratory agricultural worker, seasonal agricultural worker, or can we not classify? All right, I'm seeing lots of seasonal, seasonal, seasonal. Okay, any opposing? Great job. So Maya should be classified the same as her mother, a seasonal agricultural worker. All right, I want to pause here. Are there any questions about either of these case studies? I don't see any questions in the Q&A box. Okay, great job, everyone. Okay, well, feel free to keep adding questions to the Q&A box that we can answer for you as we go. So I did want to move on to share a couple of additional slides and resources with you. So we do know that the ag worker verification process and the questions can be difficult, and you can run across challenges. So the next few slides outline some approaches and strategies for asking the verification questions effectively and how to navigate if a patient might be reluctant to answer the questions, and general tips and strategies. So when asking the verification questions, it's important to practice cultural competency and cultural humility, as well as using the correct language and the easiest terminology for understanding. And we get a lot of questions about patient reluctance, and we know that our local community, you know your local community best, and when we know our community well, then we are better able to tailor the verification questions. Perhaps you can ask, what is the name of the company you work for? And the response may let you know if they work in a local farm. It is also important to let the patient know why you need this information. You want them to know that you are trying to better serve them, that you receive special population funding in order to serve them at your health center. And you can let them know that the information that they're sharing with you is confidential and you're only reporting their employment status as an agricultural worker. On this slide, we've listed out a few tips and strategies to consider. Some of them we've mentioned along the way throughout the slides. The first being implementing policies, procedures, and staff training. This is really important for ensuring that staff understand the population and how to accurately identify and register them, such as webinars and trainings like today. Making sure we're asking the right questions on our registration form and providing assistance with the registration forms. If you all could share with me in the chat as I continue through these strategies, how many of you include verification questions for agricultural worker status in your registration form? Let me know in the chat. Our third strategy here is to make sure that all patients, guardians are screened for agricultural worker status and your other special populations, regardless of insurance or employment. This is important to make sure we are capturing everyone. Verification should happen at every visit. We know that sometimes it can be missed at visits, and it's important to make sure that it's happening at every visit in case status needs to be updated. And it's helpful to have additional tools available at the front desk, like Lisa mentioned, having a list of the common tasks, industries, employer names at your front desk for easy use by staff. And the last is to cross-reference your adult agricultural workers with family members who are patients of the health center in your electronic health record. This will just help you double, triple check and make sure you're capturing all of your agricultural worker patients, because like we shared at the beginning of the session, accurately reporting is tied to our funding. So it's important to make sure we're capturing every patient who meets the agricultural worker status. Okay. So I'm going to look in the chat here. Some of you are saying, yes, we do. We include the verification questions in your patient registration forms. Some are unsure. Yes, they're included in our basic screening for all clients. That's great, Julia. It's definitely something we recommend. In our health center toolbox on the website, on our NCFH website, which we'll be sharing a number of links included in this next slide, we have some example template patient registration forms that include the questions if you're curious how they could look on your patient registration form. So on this slide, we have a sampling of some of the ag worker identification resources that NCFH has developed to support your ag ID process at your health center. So the first, and all of the links to these resources will come through in the chat. The first is a link to our archived webinars. So we record this webinar today and our Orientation to Ag Worker Health webinars in both English and Spanish. And we archive them on our website so that you can come back to this information and share this training with staff at your health centers. We update these recordings each year. If there are any updates to the UDS reporting requirements or the UDS manual, we ensure to capture those and provide new resources and fresh case studies each webinar. The second tool is our Ag Worker Identification digital training tool. This is a 10-minute video that reviews the verification steps and questions. It's a great tool for incorporating into your health center's learning management system. It's a great tool to share with new staff or use in refresher trainings. You can incorporate it in a lunch and learn and discuss afterwards. It's a great condensed training tool that covers the verification process and questions that we shared today. The third tool is the IAC Q&A packet. This compiles frequently asked questions from the past IAC workshops, webinars, and trainings like today. The questions are answered in detail in this packet, and they include accompanying resources and links to further information and resources within this packet. It's a great tool because likely a question you have, another health center may have also had, and we try to capture and update this as we receive frequent and similar questions. So it's a great go-to resource. The next tool is the Ag Worker Identification Front Office Reference Sheet. This tool was designed to help health center staff ask the right questions. So there is a little recap on the verification questions and tips for accurately identifying and classifying your patients. But there's also, it's a customizable PDF. So you're also able to update the pictures within this document to reflect the industries in your area or the various crops in your area. And it's also a great resource to add the lists of tasks, employers, companies in your area, and keep it at the front desk as that cheat sheet and that go-to resource when you're interacting with patients. Some health centers have even laminated this resource. It's very COVID friendly to wipe it down, use it as you interact with patients if that's helpful, and it's just a great customizable tool to have at your front desk. The last tool on this list is a tool for identifying and reporting your H2A workers in the UDS. We know that the numbers of H2A workers across the country are increasing, and it's important that we know how to accurately report H2A workers in your UDS reporting. So this tool provides some background and demographic information on H2A workers and also on what the H2A visa program is. It distinguishes the differences between H2A workers and H2B workers. And it also provides some examples of working through the verification steps when looking at H2A workers. So this tool is helpful for better understanding the program and to help your health center better classify and report and serve these patients. So the next resource we wanted to share is to talk about the Increased Access to Care program and the associated training opportunities. The IAC program was launched in collaboration with the Ag Worker Access Campaign, which we mentioned earlier in the session. And this program was created to assist community and migrant health center staff with their accurate identification and reporting of their ag worker patients in the UDS. Since the program began, it's grown to include a national virtual network comprised of health centers, health center controlled networks, and primary care associations that are all working toward the mutual goal of increasing access to care for their ag worker patients and their family members. So a couple of offerings and opportunities within the IAC program. The IAC Learning Collaborative, we have a learning collaborative. It's a great opportunity for learning from and discussing promising practices and challenges with health centers across the country. This includes learning sessions where we bring in guest speakers, offer tools and resources, and allow for peer-to-peer discussion. The second bullet there is ag worker identification and registration quarterly huddles. I will share on this on another slide. It's a new offering that we are offering, and our next session is coming up in December. It's a quarterly offering where we provide case studies and allow for more interactive review of the Ag ID process and a space for health centers to come ask questions. We also offer migrant health action planning through the IAC program. So let's say you are interested in updating your patient registration forms or creating a training plan so that you can refresh the Ag ID training with your health centers throughout the year. You can utilize migrant health action planning to develop goals and set action steps to meet those goals in order to increase access to care for your ag worker patients. The IAC program also gathers UDS data information twice a year to track the progress of your health center towards increasing your number of ag worker patients. And overall, it is a program designed for sharing knowledge, tools, and resources. There's a link to learn more information about the IAC program in the chat. And as I mentioned, the Ag Worker Access Campaign, we encourage you to join the campaign and to sign up to be a member to receive information and resources related to the Ag Worker Access Campaign. The registration will be, the sign up link will be coming through the chat. And I wanted to just pause here and say thank you so much for joining this webinar. This ends the recorded section of our presentation, and we're going to pause for the recording here and continue on to provide an evaluation and answer questions. So thank you all so much.